Why is it so important to include pre-hospital treatment strategies into a comprehensive training program like the NTSC Vienna?
Well, if you want to have the whole picture, you have to include the pre-hospital management and care also for a training program like we do in the NTSC Vienna. So a patient with severe traumatic brain injury require optimal management from the earliest time point. Ensuring oxygenation, ventilation and also blood pressure are priorities. Therefore, transport should ideally be done by helicopter to avoid further stress from horizontal acceleration.
What will you focus your training content on the NTSC 2023?
We want to discuss the concept of pre-hospital care for patients with severe traumatic brain injury, the choice of a rescue vehicle and the right destination hospital. Ideally, depending on the location of the event, it will also be possible to see rescue equipment, see rescue helicopters and all the stuff you need to make perfect care for these patients.
What fascinates you as a neurosurgeon to focus on neurotrauma?
As a neurosurgeon, the fascinating thing is that neurotrauma is one of the oldest tasks we have. It is one of the most basic main competences, and neurotrauma in neurosurgery is older than neurosurgery even exists. So decompressive craniectomies have been done thousands of years ago.
What will be the take-home messages in 2023?
So the pure surgical disease has become a biological disease. We have a lot of add-on therapies. It's not only the surgical side of the story. In addition to that, we have extremely high sophisticated possibilities in terms of taking care for intracranial pressure management. We have a lot of possibilities even for the further treatment of those patients.
Why is the module Neurotraumatology so important for the NTSC?
The module traumatology is very important because the TBI was, is and will be one of the leading causes of death and disability worldwide. Therefore, it is a big advantage and necessary to have well-trained and highly educated surgeons worldwide.
And what will be the essential topics?
I would say the essential topic would be TBI with traumatized patients, because this is the Champions League of the traumatologist. I'm a traumatologist, and therefore it is also necessary to have, for the good outcome of these patients, well and trained and experienced doctors, especially surgeons.
What is the value of simulation training, and can this also be done effectively in suboptimal hospital infrastructures?
Yes, I think this is the simulation training can be done in any infrastructure because it's more about the communication between the groups and working together in multi-professional teams, and the infrastructure of the hospital is not that important.
When reflecting about the first NTSC, will you change some content or some focus?
I was very happy to work with all the different nationalities and professions, and I think this is an important part and should be a big part in this training.
Looking ahead, what will be surprising for the different teams participating in May 2023?
I hope they will not be surprised. We hope to meet their expectation, showing them our individual and multidisciplinary treatments in our Reha Center.
Why is it essential for medical professionals treating NT patients in the acute phase to learn about your specialty subacute neurotrauma rehabilitation?
Because the treatment cycle for patients with head trauma is an integrated cycle. And, it's like a chain. And the weakest part in the chain decides about the outcome. So we should all be experts in our part and should know about exactly what comes first and what comes second.
What can participants expect in 2023?
Well, they can expect a fancy group of neurorehabilitation specialists who will show them evidence-based treatments, algorithms in trauma rehabilitation at our center.
And please complete the sentence. The NTSC Vienna is so amazing because?
Because it's a unique possibility for colleagues from all over the world to mingle with colleagues on one topic in trauma rehabilitation.
Because I'm convinced of the idea of providing medical care that is as standardized as possible.
Because it's a true, unique thing, and there is nothing similar worldwide.
Because we, the faculty, were highly educated and well-experienced surgeons, and the specialty would be that we collaborate together, and therefore we have the power together to improve the outcome of patients with TBI.
The NTSC Vienna is cool because many professions are working together in a team to take care of one specific patient.
Because we are able to share our experiences, how the early and acute rehabilitation positively impact to the survival rate, recovery time, and of course the better functional outcome.